Buffalo County Community Partners worked for several years on looking at ways to impact access to care. We had a very high prediabetes and diabetes rate. And what we were finding is individuals weren't accessing primary care in our community, and they weren't being able to get in the door to see primary care. Well, our plan quickly developed into identifying 250 individuals in our community who are uninsured and unable to access primary care in our community. We wanted to partner those 250 individuals with 1 to 2 community health workers. And what we wanted to be able to document is if we put community health workers in our community, worked with those individuals that were most at risk, could we save enough dollars in the healthcare system to document the need for community health workers? The first 50 individuals that we saw in the pilot, there was a lot of barriers that they were facing, whether it's a language barrier or very expensive procedures. They self-reported over $250,000 in medical debt. We also saw high utilizers of the emergency room because you're not able to access your primary care, so you're starting to move into the emergency room as your primary care location. One individual had been to the emergency room 14 times in the year before we enrolled him in the project. And every one of those were things that could have been handled in a primary care setting. And so what we did is we went to the community health workers that we had hired for this pilot program, and we said, how do we reach 250 individuals? And they said, we go door to door, we go talk to people. And that's the beauty of what community health workers bring to this. They worked with individual physicians who come to the table and said, yes, we will help. They worked with office managers within our primary care practices that said, yes, we'll put up a sliding fee scale. We began to see a 4-to-1 return on investment almost immediately within the first year. We were shocked, absolutely shocked to see that amount of return on investment even within the few months that we started. We soon found the dollar amount of savings to the emergency room was well over $1 million. In the business sense, if you were a for-profit business and you could hire one person that can have a 400% return on investment in your community, that would be something ideally that you would want to look to and invest in. Of course, we went straight to the hospital administration. We went back out to primary care to say, this is the cost savings we're starting to see by being able to prevent people coming into the emergency room and being able to navigate the services better in our community through the alignment of the most important element of the whole program, which is community health workers. The data started talking to us in year 1, and by year 2, we realized we needed a clinic to serve the needs of this population. And just 1 year after the completion of this pilot study, I'm sitting in the healthcare clinic that was built to serve the needs of those individuals that we were serving through the pilot program. There is absolutely no way we could have done a project of this size and shown the return on investment in our community without the use of community health workers. They are absolutely the key factor in this project.